Massive federal budget cuts are hitting agencies responsible for protecting America's health. That includes billions in funding for infectious disease management. Take syphilis, once nearly eliminated. Well, it's now increasing sharply across the U.S. CBS medical contributor Dr. Celine Gounder takes us to the sprawling Navajo Nation, where solutions to the now national epidemic are emerging.
When your doctor's office is bigger than West Virginia, it's important to go to your patients.
We're surrounded by a southern part of the Navajo Nation.
Melissa Waeko is a public health nurse in a unique program to fight sexually transmitted infections across the vast Indian reservations of the Southwest.
The scope of all of this is to ensure that they get treated right away.
That hurt?
No.
And so, like I said, it's a preliminary test, all right?
We thought that congenital syphilis was eradicated, but it wasn't.
Faced with a patient population with high rates of poverty, limited transportation, and spread across 3 states, Waeko's team hits the road.
And what are some of the kinds of places you go to test people?
Food pantries, they've gone to the jail, they've also gone to alcohol treatment.
One day last December, the clinic was a church near homeless encampments in Gallup, New Mexico.
Do we have your consent to proceed?
These are folks who have no home. They're folks who have no income. They're just surviving day to day.
We've got a guy with...
Dr. John Iralou started his career with the Indian Health Service at the height of the AIDS epidemic. He's been fighting infectious diseases here ever since.
It's all about testing and immediate treatment. You have a person right there, you might not see them again.
Right there can be a motel room where a patient and her 3 kids live.
So you'll need to repeat your syphilis testing?
So it's working?
It's working. We're seeing better than 20% drop.
It's gonna bend your finger over.
Progress made easier by hard lessons.
If we had done this 10 years ago, before the COVID pandemic, people would have been afraid. People are used to these sort of public health interventions and are a little more open, I think. In some ways, the pandemic was part of the problem, but it's also part of the solution.
Part of a solution from Indian country they're convinced can help patients across the U.S.
So we're the first ones in the United States to put something like this in place. We've put the foundation in place for others to follow.
A foundation built on treatment where and when it's needed most. For CBS News, Dr. Celine Gounder, Gallup, New Mexico.